Do you know the human heart, a tireless muscle, beats roughly 100,000 times a day? With each beat, it orchestrates a symphony of sounds, audible with a simple instrument. The stethoscope. These sounds, far from being arbitrary, provide a crucial window into the heart's function. Doctors rely on these subtle cues to diagnose a range of cardiac conditions, making auscultation, the practice of listening to heart sounds, a cornerstone of cardiovascular examination. Imagine the heart as a four-chambered house, with doors, the valves, regulating the blood flow between the chambers and out to the body. Each heartbeat is like a carefully choreographed dance, with blood moving in sync with the opening and closing of these valves. While we might not feel this intricate ballet within our chests, we can hear it. Contrary to what one might expect, the heart sounds we hear don't originate from the opening of the valves. This initial phase of the cardiac cycle, where blood flows through the open doors of the heart chambers, is a remarkably silent affair. The real acoustic drama begins when these valves snap shut, preventing blood from flowing back, much like a door slamming shut. The first heart sound, often described as a lub, marks the beginning of the heart's rhythmic cycle. This low-pitched sound occurs when the two atrioventricular valves, the mitral and tricuspid valves, slam shut. Imagine these valves as the heavy, ornate doors separating the heart's atria, the receiving chambers, from the ventricles, the pumping chambers. The lub sound is best heard at the apex of the heart, which is located just below the left nipple. This sound is slightly longer in duration and lower in pitch than the second heart sound, giving it a distinct quality that experienced clinicians can easily identify. Section 4. The second heart sound. A whisper before the encore. Following the lub comes a shorter, sharper sound, the second heart sound, often described as dub. This higher-pitched sound signals the closure of the semi-lunar valves, the aortic and pulmonary valves, which guard the exits of the ventricles. Think of these valves as the smaller but equally important back doors of the heart, ensuring blood flows out to the body and lungs. The dub sound is best heard at the base of the heart, which is located just below the collarbone. Its higher pitch and shorter duration create a distinct contrast to the first heart sound, completing the iconic lub-dub rhythm that resonates as a testament to the heart's tireless work. Section 5. Beyond the basics. The third and fourth heart sounds. While the lub-dub duo steals the show, the heart can sometimes produce additional sounds, known as the third and fourth heart sounds. These sounds, often too faint to be heard with a regular stethoscope, can provide valuable insights into certain cardiac conditions when detected using specialized equipment. The third heart sound, a low-pitched sound occurring shortly after the second heart sound, can sometimes be heard in healthy children and young adults. The fourth heart sound, even more subtle and difficult to detect, occurs just before the first heart sound and may indicate an underlying heart condition when present in adults. Understanding the nuances of heart sounds, from the prominent lub-dub to the subtler third and fourth sounds, empowers medical professionals to diagnose and monitor a wide array of heart conditions. This symphony of sounds, often taken for granted, serves as a constant reminder of the remarkable organ beating within our chests.